This brings us to our health update. President Johnson and trustees, you've been experiencing health updates regularly since mid-March. Unfortunately, during the time of this meeting this evening, the U.S. has broken another single-day record with 140,000 cases identified today. So I know that we've been receiving these updates regularly, and sometimes it's hard to hear all of the numbers. And yet, trustees, as our public commenters referenced this evening, we are truly in a different place with this pandemic at this point in time. And I know we're all anxious to hear what Ms. Bacalor has to share with us. In addition to the surge in cases, there also have been a couple of really exciting announcements this week. So Ms. Bacalor, we're hoping that you can help us to make sense of all of it.
Good evening again, everyone. I'm hoping right now that you are seeing my big blue slide.
Yes.
Is that correct? Great. All right. So let's just dive in. The hour is getting a little bit late. Today I'm going to do a different type of presentation. I'm starting with a quote that was in the Bridge magazine last week. And the quote is that doctors and health officials worry that 8 months of numbers and charts and maps have turned even the most sobering data into a kind of white noise, with too many residents not following basic advice. And I fear that I contribute to that white noise. So today, we're going to have a chart-free presentation. I would ask you to raise your hand to see if you're excited about that, but I won't. So today I'm going to just be talking about things with you that are important. So we'll start with the current local COVID-19 situation. We will get into recent reports and emerging research, talk about the upcoming holidays, in particular Thanksgiving, and then I'll take your questions. All right. So I do need to talk about our dashboard. Unfortunately, it's still showing that we're going in the wrong direction. And one of the things with the MySafeStart map is that you can look at it at different days and it will tell you something different. So, we tend to retrieve the data from MySafeStart on Friday mornings. And on Friday morning, it was reflecting data from November 3rd. So the November 6th data was based on November 3rd. Well, you look at it again, it's completely different now. And I just wanted to point that out. This is a point in time dashboard, but we do see that the numbers can change. And in this particular case, unfortunately, they got worse and we're still in E, and the trend was still up as well. So you're all aware, I'm sure, that in Washtenaw County, we've had this surge in cases. Unfortunately, we've hit some milestones that are not good for us. Yesterday, Tuesday, November 10th, was the highest daily case number of the pandemic in our county with 133 cases. Over the past couple of weeks leading up to last Thursday, it was the first time having over 1,000. It was 1,010. So the percentage of cases in that 18 to 22-year-old age group has gone down, and community members of other ages has gone up, the cases among those community members. And you might remember last time I showed you a fancy chart. So there have been some MLive headlines reflecting this surge. And I do want to point out, last time I presented some data on residential zip codes, like not really the U of M campus. And those zip codes as of last Thursday were continuing to rise while the campus numbers are down. So what does that mean for our local public health capacity to have this big influx of cases? Unfortunately, it's been rough for our colleagues and partners in public health. And I talk mostly about Washtenaw County Health Department, but in fact, we're often dealing with Livingston County, Oakland County, and Wayne County. And our last two cases that we've had to report are staff people who live in Livingston County. So I just want you to keep that in perspective. Unfortunately, everywhere those test turnaround times have lengthened. People are waiting days longer to get their test back. Our local health departments are handling a lot more cases. And as I talked about in the last meeting, the cases tend to have many more contacts because they're younger people than in the first wave of the virus in the spring. So the staff are needing to make hundreds of calls per day versus a much smaller number. So it's just more time. So the volume of the cases has impacted contact tracing. And the Washtenaw County Health Department told us in the schools group last week that there will be a longer wait time for them to respond to us, and that we need to depend on our own internal processes to alert people about their need to quarantine. So fortunately, we've really refined our internal case investigation and contact tracing systems. We have 5 people who are trained to do this. And I just want to give a shout out to the AAPS COVID-19 response team. They're doing a lot of work that's pretty much invisible behind the scenes to keep our campuses safe. So one thing that the health department did was they released this document, if you test positive, so that if people are out there and they get a positive test, they know what to do. It's about isolation and it's kind of a DIY. If you get a positive test, self-isolate, tell your close contacts yourself that they need to do it and when they can return to normal activities. And, we have noticed a delay, but really delays more significantly from other county health departments that we're in contact with, that we're often the first and only person who is telling someone about quarantine. So, and then like a week later, the person will finally get the call. So, a lot of times the public commenters talk about, we're stuck in this old model. We're not looking at emerging research, but the fact is that we're always looking at new research all the time. So I have some of it for us here today to take a look at. The American Academy of Pediatrics released a report yesterday. They do this every week. I've put a link in the slide talking about over the past couple of weeks, every week has set a new record for the number of child cases. So last week it was 74,000 across the US, the highest since the pandemic began. And a couple things they point out in their report, which is good news, is that severe illness, as we've talked about many times before in board meetings, seems to be rare among children, which is great. However, they point out there's an urgent need to collect more data on those long haul impacts on children. I know about a couple of those just anecdotally, but what we know that among adults, there are 10 or more % of people who have these long-term physical ailments and symptoms. And so the AAP is just saying, we need to collect that same data for kids. All right, so a lot of public commentary about the research on young children in schools. So I just want to let everybody know, yes, I have read it too. And I really like this recent World Health Organization report. It compiles a lot of great information with links to studies in it. So what we're finding is that young children in schools do not appear to be the main drivers of transmission internationally. And, the report is based on schools in different parts of the world that opened before schools in the US did. And that also elementary schools appear to be less likely sources of outbreaks than middle and high schools. However, they're careful to point out the data is still emerging on this, and that's the risk of school outbreaks rises when community spread is high, and community transmission is actually reflected in the school setting. And I have to say, just from my lived experience this fall, we are hearing about and seeing way more cases right now among our families and staff than we did in September. It's just more, and they're not on campus, of course, but some of them are, but most of them aren't. And it's just there, like it's just happening. So I know that people want to draw a straight line from this research about young children in schools do not appear to be the main drivers of transmission, a straight line from that to us needing to reopen right now. And I just need to point out that it's more complicated than that. And this is why. A lot of school districts started out open and now have had to close or have had to postpone opening in the first place. And I'd like to point people's attention to an article that came out in today's New York Times called "Will Any More Schools Reopen in 2020?" And just to give an overview of these challenges, because the impact of the community spread means that there's staffing shortages. We're seeing this all over Michigan. You can see these headlines that I've included. Staff who are in quarantine, staff who are infected. It's a real thing. We have to acknowledge it. The other thing is that we're seeing from the Michigan Department of Health and Human Services report that in Michigan, we are having some school transmission. So the report that came out Monday reported 44 new schools had outbreaks with 160 new cases. And of course, this is only confirmed cases. It's not probable. So it's already a little lower than we would think. And of those 160 cases, 42% of them were in preschool and elementary schools. So we have different data, right? We have to be able to discern what's all of these different things going on at once. One thing that is being pointed out again and again is that the social activities connected to schools are driving much of the spread and the risk. And we have seen this a lot this fall. The slumber parties, the team activities outside of school, other types of social gatherings that are just occurring that create spread among adults. And what we have seen more of is adults actually infecting their kids at home. So it's a more complicated picture than just going straight line from elementary schools are safe maybe to us reopening. There's just more to it than that. All right, so let's talk about Thanksgiving, because this is something coming up. It's on all of our minds. And this is a kind of critical point in the pandemic. We're going into these winter months. There's been all this doomsday talk about what's going to happen. It doesn't have to happen that way if we are all really careful and we just make a commitment to being careful. So I really like the CDC's Celebrate Thanksgiving. I put a link in there, but you can just Google it if you want to. They give really great advice about hosting or attending. It's stuff like, it's a little bit hard in Michigan, but having an outdoor meal, and if that's not possible, limiting the number of guests, really talking to people ahead of time to have clear expectations about what's going to happen. Is everyone going to wear a mask? Yes, do that. Cleaning and disinfecting, having people bring their own silverware and food and drinks and plates. So, only having people who are preparing food in the kitchen, not having people in and out. So that, just some kind of things that will make Thanksgiving very different, of course, but that could keep people safe. There's also advice for travel and some really fun ideas for alternative ways to celebrate that are that families can do at home if they're not going to risk getting together, etc. So I would just recommend taking a visit to that site. So on a more positive note, Dr. Fauci, who I will just give a toast to with my Fauci mug right now, said a couple weeks ago, it is still not too late. It is not too late to vigorously apply good public health measures without necessarily shutting down the country. And we said this on October 16th. Things have gotten a lot worse since that day, but I still want to believe it. And there's a little video that you can watch that goes with it. We saw great news last week about potential vaccine efficacy from Pfizer. That's awesome. Like, we're heading in a good direction there. But of course, we don't want to wait for a vaccine. We want things to be better so we can get kids back in school buildings. So I will just end it there and take any questions that you might have.
I want to thank you, Ms. Bacalor. This is tough. It really is, and I do appreciate you mentioning some of the non-health impacts and that making the statement that we are keeping an eye on that as well, and bringing up the very real fact that this is pretty new at this point, and I know that one of our thoughts in making this decision to stay virtual was that we wanted to look and see what was going to happen in these schools that decided to do otherwise. And what we are seeing is some significant spread with very similarly sized districts. And so, I do think that we'd be in a different place if we were talking about 100 cases in Ann Arbor Public Schools in a month or so, like we've seen other places. And so I do think that it is, maybe in a future presentation, we can actually do some comparisons. Maybe that might help the public a little bit to understand that. But I actually had the opportunity to talk to some parents, and I will mention that we're open to other information and perspectives. But one thing that started to come out and does come out in some of these comments is a lack of trust, and I do think that there's only so much that one can do to earn one's trust. And there will be some situations where no matter what you do, people are going to not trust you. And as a board, we can't always worry about that. We have to work in good faith. And to Trustee Nelson's point, I do hope that our very transparent communication about how we're tracking this and what we're thinking about does engender some trust with the community. This would be so much easier if we could just wave a wand and send everybody back to school face to face, and we wouldn't have to worry about people getting sick and the long-term effects of COVID and all that. But that's not the reality that we live in. And so I just appreciate you coming here every single meeting and sharing this information, and the trustees for being so thoughtful throughout it. It is tough, but I'll reassure the community. We've said it, probably 10 times today. I'll say it again. Our goal is to get back to face-to-face instruction. Full stop. That is our goal. But I can feel comfortable as one trustee saying, I don't have any appetite for rushing it just because we're tired. I do think that we need to be, we're making decisions for large groups of people, and these are, have long-term implications. So being careful and prudent, and having all the supports necessary is what I want to see, and that's what I do tend to see, throughout this. So thank you so much for that, your work.
Trustees, Ms. Bacalor said she would not be sharing a lot of charts. I do have this one. The data was drawn this morning showing Washtenaw County at the highest level rating, level E. And you can see there a very high number of cases, new cases, this morning at 228 per million. So it is because of that I will continue our same recommendation to remain in a virtual learning status. And we will continue to monitor our data week by week. I appreciated Ms. Bacalor sharing the holiday guidance. There's a lot of good guidance out there because we do understand that that this is a very vulnerable and risky time going into the holidays with high levels of community spread. Particularly, we're seeing with cases in the district, and we had another case reported today. Trustees were experiencing two things. One is our Washtenaw County Health Department phenomenal team can no longer keep pace, and they've been clear about that with us, with the contact tracing. And then secondly, we're experiencing a much longer turnaround time on our testing results. So last week we had an employee go for a test. She remained out of work while she was awaiting the results. And trustees, she was out of work awaiting the results for more than a week. That's what you're supposed to do. That's important, and she did the right thing. But it would be very difficult to have a confident reopening with any size of group with that long of testing window. So the recommendation is to continue in virtual. Trustees, our next steps is that we monitor the data daily, and we update our chart weekly. We heard the commenters this evening. We certainly are open to adjustments as we learn more through this process. But at this time, the rates of infection are many times over the consider phase and the recommended phase for a reopening. When we do see a window open, we will begin with small groups of students, with our special needs students and our youngest students first. That will be our rhythm. And in the meantime, we will continue to wrap as many supports around our students as possible. We worked this evening, and I appreciate the patience of the board. It took longer than we anticipated, but our goal was to share the wide body of work that our team members are engaged in to extend support during this public health crisis. I want to turn to our winter athletic question. We do understand the benefits of student sports and athletic endeavors. Trustee Nelson, I appreciated you raising that thinking around there are different risks, and we understand the benefits that go along with being able to participate in sports. Not only that, self-development, but the interpersonal team and competition factor, and that high school sports can provide a gateway for students into higher ed. At this time, the infection rates are very high, as we've shared. So it is our recommendation to continue to delay the start of winter sports season while we monitor COVID infection rates. Trustees, as I've shared with each of you, we will invite those coaches. They are ready to work virtually with their teams and to prescribe the workouts so that our athletes can remain fully prepared and be ready to go. We will continue to work with those across our Southeastern Conference. We do have interest from about 3 other districts in an approach similar to what we're describing here, is that we would continue to monitor. And if we can see an opening in the data that would allow us to, we would have a January abbreviated season that would be very similar to what the NCAA is doing. Mr. DeAngelis and I will put a statement out to schools, to student athletes, and to parents tomorrow. We wanted to be with the board first this evening. So this is a graduated 5-phase plan, but I do want to be clear that we will have to see infection rates come down in order to be able to allow sports to proceed. We are not at that point at this time. So at this time, we're asking that our athletes participate with their teams in a virtual arrangement. And that will be where we are for the coming, at least through the end of November. We will reevaluate the 1st of December, trustees, and keep you posted if we're able to move in to another phase of this plan. So our next steps is we will be monitoring the rates of infection. We will extend the survey that we had, the fall survey, to our parents of students with an IEP. We really want to get into those particular needs and issues and make sure that we're hearing from everyone. So that will be coming out in the next few days. We will continue to refine our virtual learning to provide more support, as Trustee Lazarus pointed out, to continue to communicate and to deepen our communications in ways that families can hear and see the information. And we will continue to monitor the data. We all know the steps that we need to take. And again, a reminder that our full plan is on the website if folks are interested in more information. I always end this part of the update by just acknowledging that the COVID crisis, as we know it, is far from over. We will continue to work vigorously every day to extend every support we possibly can during this time that is so challenging for our students and staff, our parents, and our community. Bringing our students and staff back into our buildings is our focus, and yet we need to acknowledge that it will be the single greatest challenge that this board, that our leadership team and our full Ann Arbor Public Schools team, and that our parents and community will face. It is the greatest challenge as to how to do this all together. So trustees, I appreciate this opportunity to update you this evening. We're happy to receive any questions or comments. And then we'll move over to end on a more positive note, which is our Rec and Ed update, which will be brief. And thank you.
Thank you very much, Ms. Baccalaureate, Dr. Swift.